welcome back to Army in White. Today we will be talking about some of the questions from some of the MCQs from the topic pneumothorax. In the last two videos we have talked about the topic, and if you haven't watched those videos, please go and watch them. They are just two videos, they are short, and you can solve all this question and it will help you build your basics. Okay, so let's do these MCQs and let's close the topic pneumothorax. So the question here is number 1. A 24-year-old man is receiving positive pressure mechanical ventilation in the ICU after sustaining multiple trauma in the road accident. Okay, in the road accident, the patient has sudden onset of hypotension and dyspnea. Most appropriate immediate management is here. Okay, the patient is receiving positive pressure mechanical ventilation. See, in a road accident, hypotension and dyspnea are sudden onset on the patient, and what is the immediate management for this patient? Let's look what are the options. Chest x-ray, CPR, needle decompression, catheter aspiration. In this type of situation, we will not go with the chest x-ray because it is a life and death situation here. CPR cannot be given here because the patient is undergoing positive pressure mechanical ventilation, and catheter aspiration is not the option. So the option here is needle decompression. Okay, needle decompression should be done immediately because this is the life-saving step. In this situation, only and only needle decompression will save the patient. So needle decompression should be done with what? With wide bore needle from second intercostal space. You can check the video, this is explained very well there. The only step that can save the patient in this type of condition is needle decompression with wide bore needle from the second intercostal space. Okay, this should be remembered. So the next question is, what type of untreated pneumothorax is considered to be the most serious one? See, which type of pneumothorax is the most serious? We all know. Let's look the option. Primary spontaneous pneumothorax, tension pneumothorax, malignant, or secondary spontaneous. So the option here is tension pneumothorax. We all know this is the most dangerous and the most serious type of pneumothorax. Okay, and what is the primary cause of hypotension in patient with large pneumothorax? What is the primary cause of hypotension in the patient with large pneumothorax? You know, no, that in hypotension, that is the blood pressure decreases. Why? Because of cardiac output decreases. Why? Because there will be compression from the opposite side of the lung, that is if left lung undergo pneumothorax, it will push the cable system, heart and heart vessel to the right side. Okay, so what are the options? Pain, trauma, decreased venous return to heart, trachea deviation. So the option here is the third one. C. This is the decreased venous return to the heart. If there is decreased venous return to the heart, it will be decreased cardiac output, so this leads to hypotension. Okay, so the option will be C. So let's look the next question. Underlying lung disease is present in which type of pneumothorax? Let's look what are the options. Primary spontaneous pneumothorax, tension pneumothorax, all type of pneumothorax, secondary spontaneous pneumothorax. Our answer will be secondary spontaneous pneumothorax. Okay, in the primary spontaneous pneumothorax, there will be no any underlying lung diseases. It was idiopathic earlier, but now it has discovered that due to rupture of bleb, primary spontaneous pneumothorax occur. So our answer here will be number D, secondary spontaneous pneumothorax. So what are the underlying lung diseases? The underlying lung diseases can be COPD, it can be bronchiectasis, it can be asthma. These are the underlying. Any type of obstructive lung diseases can lead to secondary type of spontaneous pneumothorax. Okay, so with this very short video, I was just hoping that it will make your basic more strong. So please like, share and subscribe, and we will be doing next pathology from the respiratory system in the coming videos. Thank you guys.